The last week or so, we've talked about how we need to, as Ohioans, do two things at once. Bring back our economy, at the same time stay safe. We are Ohioans, we can do it. And I want to talk a little bit about that today. We're going to be making a couple of announcements today about things that we are opening up in the economy. How we open up, how we do it, is so very, very important. And the how is really an essential part of how successful we're going to be in doing these two things. We have asked businessmen, businesswomen, professionals to work with experts in health, people from health departments around the state, in a number of different working groups. We have two announcements today, and we have groups that met on the phone, people from all over Ohio who tried to come up with literally the best practices as we open businesses up and as we open professions back up. I know people are very excited and looking forward to this. To kind of recap, last Friday, hospitals that have been open, but they've dramatically expanded what they're doing, and it's really the time for people to get caught up through their dentists, through their doctors, through their hospitals, with past health-related issues that it's time to take care of. And so we encourage people to do that. But last Friday, May 1, was hospitals. This past Monday, May 4th, was manufacturing. It was other distribution businesses, for example. Those that were not open have now been opened. And in that case, we had a working group. Frank Sullivan headed up a working group of people from all over the state of Ohio, big businesses, small businesses, who came up with the best practices. And they're following that as these companies open, and even the ones that were already open are now following those best practices. Again, it goes back to the how we do it, how we stay safe as we restart this economy. Looking forward now, May 12th, next week, this coming Tuesday, virtually all retail will open up. And so at that point, 89% of our private economy will be back open in the state of Ohio. In each of these cases, we had groups that have done just an amazing job to come up with the best practices. And what we're trying to marry is the science and the practicality of that profession or that business. Every business is different. Every profession is different. Bringing people in who understand that, who do it every day, along with the science, we believe that we've come up with the best practices. So let's talk about today. We put a working group together to look at hair salons, to look at barbershops, day spas, nail salons. And we have today their report, which we are making public, providing the best practices as these professionals start back in. We have set the date of May 15th, week from tomorrow, and I'm sure that that's good news for a lot of people who've been looking to get back, particularly in regard to their hair. I know I've heard a lot about that. And so, again, I just want to thank the working group. We had barbers, we had hairstylists, we had people from all over the state of Ohio who helped us do this, who wrote these recommendations, who came up with the best practices. And so I'm going to, at this point, ask the chair, Deborah Penzone, and ask her if she can Skype in here. Eric, we'll see if we have her on here. and I'm going to have her give a little report about, kind of who they had on their group, and what things really they recommended, what will be really different as we look to the future as they go back in. And it looks like Eric is having trouble pulling her up. All right, I will move on then, and we'll get back to Deborah in a moment. Let me talk about restaurants and bars. I want to thank the group. Trevor Weaver headed that group up. We'll hear from her in a moment. Both of these areas, restaurants and bars, are already significantly regulated, highly regulated by the state of Ohio. The same is true in regard to hair salons, barbershops, very, very much regulated. So we start with that. In regard to the restaurants and bars, they're certainly regulated in regard to the Ohio food standards. The group that was put together included people who run restaurants, cafes, diners, everything from a very small diner in rural Ohio to a chain of restaurants. And so we had a lot of different people weighing in, coming up with the best practices. We have set the dates for them to come back, beginning for outside dining on May 15th, and inside dining on May 21. So that's May 15th, outside dining, May 21, inside dining. Can we do anybody by Skype yet? Eric. How you doing?
Hi, fine, Governor. Thank you.
Thanks for joining us. You want to tell us a little bit about your group and kind of who you pulled together, and kind of what will be different when customers come in, and what maybe will be different for the employees and the folks who are in charge. Just kind of tell us how this will look a little different.
Absolutely. Thank you. It was certainly my pleasure to lead this talented group. As you said, we had a wide variety of folks on the team, and we also had representatives from the health department. And it was really an amazingly collaborative effort. And I felt like the differences, while on the surface could look like they could be challenging, they actually strengthened the recommendation that we put together for you. And it was certainly, like I said, my privilege to lead them. You asked if I could share a few examples of maybe what the customers will experience as we reopen Ohio, our bars and restaurants. Let's start with space. So restaurants and bars are going to be asked to create a floor plan that it complies with current social distancing guidelines. For example, under the current mandate, there are parties of 10 or less that would be seated together, and then each party is then going to be separated by either 6 feet or a physical barrier. So rather than having a hard and fast percentage like some states are doing, our advisory board actually focused on safety, not necessarily a specific number. So what do we mean by physical barrier? That could be fine dining, for example. You could have a high booth back that's almost like a wall. Or in some locations, they're using plexiglass that's being installed to separate. So we wanted to give each owner an opportunity to comply with those constraints within their unique space. What about waiting areas? You might be asked to wait in your car for either seating or maybe food pickup, or there might be a designated area now for queuing. And we would ask customers to just comply with those guidelines and be sensitive to those guidelines. A buffet bar or a salad bar will now be served to you rather than self-service. And there'll also be some 6 feet guidelines that are placed in those queuing lines as well. Entryways, for example, customers are going to see at the entryway when they come in, there's going to be a list of COVID-19 symptoms, and we're asking the public to self-monitor and ensure compliance before they come in. Employees was also one of the areas that we tackled. And so as you're entering and experiencing these restaurants, understand that while employees will be required to wear masks in certain positions, there are exemptions that will, for the restaurant industry, mostly apply to back of house. But if you see employees not wearing masks, understand these are for safety risks. One simple example is you don't want someone standing over a hot grill wearing a mask. So just understand that these restaurants are complying, but there are some exceptions that will be listed. And you, as a customer, as a guest, you might be asked to wear a mask. That's going to be at the discretion of the owners, and we would ask that you would respect those decisions. Another thing that you might see are gloves. This is an interesting topic. I know the gloves, it kind of makes everybody feel like Superman. They can touch anything, and it gives this false sense of protection. And I know the viewing public sees that, and there's a lot of concern around it. But there are very clear guidelines in food safety code that already exist today. And we as a team are returning. Our recommendation is to return to those guidelines. In many cases, we all ask our staff, put gloves on everybody, even though we know that's not necessarily best practice. Hand washing is and will continue to be the gold standard, and therefore our committee is recommending that we follow those guidelines. So you are likely not going to see gloves on your cashiers or on your servers. One other area, Governor, that when we talked about this idea of open congregate space. So open congregate area will remain closed during this first phase, and we'll monitor our compliance as we go through this. But you could certainly repurpose that. So if you have a dance floor or other activity space, you can use that to be able to maintain that 6-foot distance of your tables. So that's why we didn't want to put a 50% of fire code compliance in place, because you might be able to keep all of your tables because of some of this open area and still maintain social distancing guidelines. So that's an example of how you could use that space. But I know we can do this. As you said, we can do two things at once. And I know we can do this. We can focus on safety and getting our restaurants reopened. So let's work through this together. We're asking everyone to don your masks. Please be respectful of the associates. They are doing the best they can. We're Buckeyes. I know we can do this, Ohio. Thank you, Governor, and I can certainly answer any questions that you might have.
Yeah, Trevor, thank you very, very much. Thanks for chairing the group. You had quite a cross-section of Ohio on there. I don't know if you want to comment about that or how that impacted it. But
Yeah, we did. It was really amazing. We had, in fact, on Thursday night when I was given the list, I plotted it because I just wanted to know who the folks were that I was, being asked to lead. And I was really happy to see we had, a lot in Cleveland, Southern Ohio, Cincinnati, Dayton, Akron, and then we had some of the more rural areas, Columbus, and we had big brands, big national brands, and the public can certainly see that was a press release. So everyone that participated, you can find that press release with the full gamut of those that participated. We had fine dining, we had pizza, Italian, we had a yogurt stand, we had a tap room, quick serve, several of our national brands, family dining. So it was really a group that worked together, and then they self-identified. So we had the three groups: customers, employees, and space, and then they each got to identify which area they felt most compelled to help lead the discussion, and then it was done across teams. They worked very hard. In fact, one of our team members said it was one of the most intense projects he's ever worked on. So for all of those in the industry, I was certainly proud to lead this group. They worked very hard all weekend long to put the best recommendations forward. And Governor, we appreciated the guidance you gave us, which was you wanted to hear from us best practices, that you didn't plan to override our decisions. It was our decisions to bring forward to you those recommendations. And so we felt very empowered to do that.
thanks, Trevor. One last question. Talk to us a moment about bars. Bars present a unique challenge. Depends on how the layout of the bar is. What did you all come up with specifically in regard to bars?
Yeah, thank you for that. So, there was one consideration, and I know many states have done this. In fact, I think most did. They separated bars and restaurants, and we chose not to do that. What we wanted to focus on was the physical space and the constraints to maintain social distancing guidelines. So, for example, if you're a bar with tables and with chairs, you can follow these guidelines. So why should you not be permitted to participate in phase one, where and it can't be about the alcohol because restaurants are serving alcohol. So we're not making a distinction between a bar and a restaurant. What we're making a distinction on is physical space. If you have tables and chairs and can comply with these guidelines, then you can participate. Really for that open congregate area. And we understand we would have loved to have been able to include everyone in this phase one, but we needed to take it through these steps. And so that open space, if you want to put in picnic tables or folding tables, you can comply. But it really is about that physical space and being able to make sure that we can monitor and have kind of discrete floor plans. And that's just hard to do with open congregate area. I hope that answers your question.
Thank you very much. We appreciate it. Thanks to you and to everybody on the group. We're very, very grateful for what you've done.
Thank you, Governor.
Thank you.